All right, so I guess we're going to move into our first segment, and we're going to do a medical 411 today. And
Nice.
this is something that popped up in a recent article. It's kind of been in the news, not plastic surgery related, but medical related. And I think it's really good because it's talking about cholesterol. And so I brought one question today, just one, but it's not an easy one. Remember last week I gave you these like softball questions.
Right, Travis, you can't cheat. 'Cause
Yeah, no
nobody
cheating,
can see you
Travis.
Well,
looking at your phone.
I never cheat, so that shouldn't be hard.
All right, fill up the question.
Should
Let
be
me
pretty
see it.
easy.
All right, name 2 of the top 5 causes of death in the United States. So these are all like causes of death in the United States, and one of these answers has 2 in the top 5, and the others are kind of everywhere. So we got cancer and kidney disease, accidents and diabetes, heart disease and stroke, COVID, flu, and pneumonia. So which one of those has 2 of the top 5 causes of death? Who wants to go first?
2 of the top 5.
Travis, I'm not. You want to go first? I have
So I will say C.
heart disease and stroke. Sarah,
Ditto.
you guys are right. Very
Thanks.
good. Yeah.
And I didn't have to cheat.
So heart disease is the number 1 cause of death in the United States, and stroke's number 5. So it's like 1 in 5 there. And so the reason I mentioned that is because the 3 biggest risk factors for heart disease and stroke are 1, high cholesterol, high blood pressure, and smoking. Okay.
Yeah.
And so this topic is pretty important because if you lower your cholesterol, you're dramatically cutting down your risk of 2 of the top causes of death in the United States. So when you talk about cholesterol, as you may or may not know, there's different types of cholesterol. So there's the LDL, which is low density lipoproteins. That's the bad one. So when you go to the doctor and they do a lipid profile, it's going to break down your cholesterol. And so LDL is the one that's bad. And the reason it's bad is that it causes plaques to build up in the arteries, and I have a picture of that in a minute. Then the HDL is the good one. So if you have more high density lipoprotein, it's actually healthy. All right. And lastly, is triglycerides. That's just the fat that's used for energy. So LDL is the one that you want to be careful about. And so when you go and get your cholesterol checked, that's the number that they're going to talk about.
Yeah.
And so I think that too. I have another info. Yeah. So basically, the LDL causes plaques to form in your arteries, and that's what causes things like heart attack and stroke, because that plaque can eventually rupture, and then a clot forms there. And if that happens in your heart, that's what a heart attack is. And if it happens in your brain, that's what a stroke
Right.
is, right? So you definitely want to keep that LDL number low. And there are risk factors for your LDL being higher. So things like if you have diabetes, if you're overweight, smoking, like bad diets like high in saturated or trans fats, also sedentary lifestyle, all those things affect your cholesterol level. And so if you go to the doctor and your cholesterol level's up, and it can happen when you're really young. Like I remember going to the doctor, I was in my 30s, which I know is not like super young, but like it's definitely not
You're
old.
probably eating like crap, huh?
Yeah, it was like during the time, like I was like, in like residency or something, and I think I was like, maybe 30.
Yeah.
And, I was eating like crap because I was like in the hospital all the time. I'm eating the garbage, at the cafeteria,
Yeah.
or like, pizza that people bring in. And like my cholesterol came back high. And I was like, dang, that's pretty crazy because, I'm not old. And at the time, like
you probably weren't overweight.
No, I wasn't overweight. Like, in fact, I was a pretty big athlete in high school and even in college.
Yeah.
And so it wasn't that far after, so I was a little surprised. So, some people might see this topic and be like, oh, I need to worry about my cholesterol. Well, yeah, actually you do. In fact, there was a really interesting thing I remember back from med school days is that they were looking at people like in wars. And so like people that were killed in action, and a lot of those are like really young people. And they actually found that people even as early as 20 had like plaque buildup in their arteries. So it can happen really early.
Yeah.
But if you go to your doctor and they do a lipid profile and they say that your cholesterol is high, your doctor might ask you to do some certain things, right? And you could probably guess what some of them are. Like, all right, if you're a smoker, don't smoke.
Yeah, I gotta stop that.
What's that?
I said, yeah, probably should stop that.
Yeah, it's funny, like, back in the day, like, everyone smoked. Nowadays it's kind of rare. You see people smoke, but like it's not near as common as it was.
It's not.
Like
That's
when I was
facts.
growing up. I remember like
Restaurants had a smoking section whenever I was a
airplanes.
kid.
You could smoke on
Yeah.
an airplane. How
That's so
crazy is
crazy.
that? Like you're in a pressurized tube filled with fuel and people are lighting up cigarettes. Just sounds like a bad idea. I don't know.
Sounds
But,
suffocating.
anyway, so stopping smoking is good. Losing weight, exercise, eating
yes.
healthy. But if your LDL gets high enough, like your doctor may say,
Yeah.
you need to take a medication, right?
Yeah.
And so that kind of comes to this
Can't
study.
you have like chronically high LDL?
You can. There's
Yeah.
a familiar, it's like familiar hyperlipidemia.
Yeah.
I had to like really kind of
I
dig
knew
deep
that.
for that one. But yes, you're right. There's a familial high cholesterol, and if you have that,
Nice.
you got to be super. Those are the
Yeah.
people
I
that
like can't have
that
fast food at all.
right, and those are the people. You ever hear like somebody dying of a heart attack at like 45, and they're like built like me? That's probably going to be a high chance that they have that familiar hyperlipidemia. But so when it comes to like your LDL being high, the big question is if it's too high, right? So if it's medium high, they'll say diet, exercise, that. But when it's really high, they're going to want you to do something about it. And this is where the study that just came out, and I think I have a picture of it, Charles, you can toss up there. The study was out of Cleveland Clinic, I think, if I remember correctly, and it was in the Journal of American College of Cardiology. So this is a very like legit, study. And basically, it was comparing a statin drug to supplements. And so I'm not sure if you guys are familiar with statins. You've probably seen them on the TV all the time. In fact, Lipitor was the most popular drug ever, like the drug that makes the most money of all time was one of those statin drugs. And what statin drugs do is they inhibit the enzyme that creates the LDL. And so that's how they work. And they're very effective. They're very, very low risk. I mean, there's like a less than 1% risk of side effects. And the side effects are not like death. It's like muscle cramps, or it can push you into like a diabetic range, but that's also exceedingly rare. And the other thing is they're really cheap because they've been out for so long that the patents have fallen off. And so now there's all these generics. And
Yeah,
so,
I'm pretty sure my dad took Lipitor.
well, what's crazy is like I remember going back to my residency days, there was one of the residents that was like in their 20s and they were taking it. And I was like, dude, why are you taking that? And then, he basically educated me that even people in their 20s can have high cholesterol and these drugs really have no side effects.
I had to take high blood pressure medicine.
You
At
do?
one point. No, I don't
Oh,
have to.
like during pregnancy or something?
It was, I was going back to school and I was so
yeah.
stressed out after I
Yeah.
had Avery.
I mean, it's crazy how a lot of these things like, can come on at an early age.
Yeah.
And like when you're young, like you don't think about those things. You're not like, oh, I need to go to the doctor, right? But I mean, it can make a big difference like later
Yeah.
on in life.
Stress, dude.
So anyway, so there's the statin drugs, but also, I'm not sure if you guys have seen this, but there's a huge, huge market for supplements.
Yes,
right?
there is.
Take supplements that does this, take supplements that does that. And we've talked about some in the past, and there's a big, big market for supplements that reduce cholesterol, okay? And so this study looked at a statin drug versus supplements versus placebo, which means taking nothing. Like they give you a pill, but the pill is like sugar or something that doesn't do anything. A Tic Tac, yeah, right. And that's why this study was kind of a big deal, because it's comparing prescription medication versus supplements, which a ton of people take, and which one's better. And interestingly enough, well, I mean maybe not interestingly, the statin drugs were the best by far. So in this study, which was a pretty big study, it reduced people's LDL by 35%.
Nice.
So if you had like an LDL of 200, it'd take it down to like 130. But that's huge. That's bringing it to like the normal level. But the interesting part was the effects of the supplements. You guys have any guesses on how good the supplements worked?
The supplements?
Yeah. So let me list them out. I'll tell you, because people might be taking these things. So the supplements they looked at were fish oil, cinnamon, garlic, turmeric, plant sterols, and red yeast rice. And those supplements are the ones that are marketed for lowering your cholesterol. So they picked all of the ones, and they looked at them all. So how do you think they did?
I would say they did poorly, yeah. I would say they did poorly.
They were no better than taking a sugar pill.
Oh, wow.
Basically zero effect, which I found surprising. Like,
I'm like, most of those supplements are found in normal
regular
recipes.
diet. Yeah, your regular
Right.
diet. Yeah.
Right.
I mean, you hit the nail on the head, and that's my big issue with like supplements and like vitamins and stuff is like, at least in the United States where our diet's pretty diverse and like, a good diet versus, maybe like a third world country where food's harder to come by, like we get all that stuff naturally. So taking more of it generally doesn't help. And so that's exactly what that study showed, that if you're taking supplements for your cholesterol, it's not really doing anything at all.
Yeah, I think
And,
the key thing to remember is just being do more preventative health
Right.
and use those
Yeah.
healthy foods and supplements.
I think most people can get away with not taking medication because
Yeah.
I'm not a big medication taker. Like, I mean, I don't like taking medications. One, I can't remember to take it, and two, just like, you know, you never know what you're taking. So like, I'm a skeptic, right? I'm not like
Right.
a medicine denier, but like, I would rather not take it. So I think you're exactly right, Sarah, that, you know, for most people, cholesterol can be controlled by doing the other things, like watching what you eat, getting some exercise, you know, changing your diet a little bit, right? And I personally would prefer that to taking medication. But you know, if the thing is, if your cholesterol gets high, it's just so dangerous that, you know, if you have to take medication, take it.
Yeah,
because
for
those medications really don't have a lot of side effects.
Mm-hmm.
And they're dirt cheap. I think I was reading that, like, if you have to take something like a statin and you have any type of insurance, then it's like $5 a month.
Yeah.
I mean, anyone can afford that.
Right.
So, but yeah, good study. So yeah, if you you know, you have your parents are getting older and they're taking supplements for cholesterol, you can let them know it's not doing a lot.
Yeah. Can you ever stop taking those supplements? I mean, not supplements, the statins.
Sure. Yeah.
Okay.
You can
And then
stop
like,
taking them, but like
yeah. So like you start like getting better, like you're eating healthier.
Yes,
you're
absolutely.
exercising,
So,
and
right,
then
so-
your doctor's like, okay, you can probably
So if you go to the
stop.
doctor and say your LDL is 200, because
Yeah.
like 190 is kind of the cutoff where they're like, if your LDL is over 190, they're going to say you need to take medication.
Yeah.
If it's lower than that, they're going to say diet, exercise, all that. Yeah, like say you go and your LDL is like 220 or something, they could put you on a drug, you could change your lifestyle, and then you could come off of it and then retake it. And chances are, like you might not take it anymore. Yeah,
Nice.
absolutely.
Yeah.
So anyway, good study. If you like that, please leave us a comment. Let us know if you like supplements or if you're taking supplements for something. Tell us what it is. We'll look it up and see if the research shows it actually works. We love doing that. We love digging in and seeing, you know, because we don't want you spending money taking something that's not going to work.
Facts.
You know? Yeah.